Oh, I'm gonna exit out of this.
I tapped it. Where'd it go? Come on.
Hi, everyone. Just waiting to get Dr. Tonk in the live. Hope everyone is doing well tonight. Just working out some little kinks. And we'll get started here in a few.
Got it this time? Oh, perfect.
There we go. All set?
All set.
Awesome. Well, welcome. Hello and welcome to our Instagram Live, Brachytherapy and Cervical Cancer. I'm Aisha McClellan. I'm the Cervical Cancer Program Coordinator at SHARE. Please share in the comments where you're joining tonight. Before we begin, I'd like to tell you a little bit about SHARE. SHARE is a national nonprofit that supports, educates, and empowers anyone who's been diagnosed with breast or gynecologic cancers and provides outreach to the general public about signs and symptoms, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars and support groups and our helplines, please visit sharecancersupport.org. Please feel free to submit any questions in the comments. Remember, the speaker is unable to give specific medical advice, so please keep your questions general in nature. Now I'd like to hand it over to Dr. Tonk, who will introduce himself. Hope I said that right.
Yeah. My name is Neil Tonk. I'm a radiation oncologist, and I'm an assistant professor of radiation oncology at the University of Pennsylvania. I lead the brachytherapy program for medicine, and I also lead the gynecologic cancer services at Penn Medicine. I really appreciate being able to be here tonight to discuss with the community what we can share about what we think you should know about brachytherapy and why it is so important in the treatment of some women with cervical cancer.
Thank you. So glad you're joining us tonight. We have a few questions prepared, and so we'll just jump right in. And again, if anybody has any other questions, we'll try to get through them on this live. Okay, so for starters, what is brachytherapy or internal radiation therapy?
Yeah, thank you. Brachytherapy is one of the handful of major types of radiation treatment for cancer care for cervix cancer. Most patients are treated with what we call external beam radiation. That's radiation that's given through something that looks like a very fancy CAT scanner. Brachytherapy is internal radiation. How I like to say it is it's radiation given from the inside out. Brachytherapy is derived from a Greek root word, brachy, which means short. So this is the placement of applicators that allow radiation therapy to deliver directly inside a tumor or directly near a tumor. Brachytherapy is the original form of radiation, discovered somewhere around the 1880s, 1890s. It's gotten a lot better, but for certain patients with cervix cancer, brachytherapy has never been replaced in terms of its efficacy and safety.
Wow, I didn't even know it had been around that long.
Yeah, the original discoveries of radium were used in the treatment of patients with cervix cancer, anal cancers, prostate cancer. So quite early, but it's gotten just so much more tremendously refined and safer to use.
Yeah, wow, incredible. When should brachytherapy be used for cervical cancer?
Yeah, thank you, Aisha. So cervix cancer is a lot of different diseases, and cervix cancer presents at a lot of different stages. So many patients with early stage cervix cancer are treated with local treatments, maybe a LEEP, a big cone biopsy. Some women may need a hysterectomy. or a trachelectomy. So for patients that can get surgery, we recommend that they go get surgery. But for patients that are not eligible for surgery, or patients where surgery does not add to their cancer care, we add brachytherapy into their treatment package. Broadly, we recommend brachytherapy be used for women with locally advanced cervix cancer. That's generally any woman with stage 1B3 cervix cancer and above. So women that have a lymph node that's positive, women whose cervix cancer has spread to the parameter next to the cervix, or even to the upper portion of the vagina. Brachytherapy is used for women with these types of stages, and that allows women to avoid an unnecessary surgery for that specific group of patient. So we use it combined with external beam radiation for generally women with what we call locally advanced cervix cancer.
Okay. So is it used at all in late stage cervical cancer, or is there, I mean, it starts at 1B2, but is there a cutoff?
Yeah. So cervix cancer, stage 1, 2, 3, and 4, and then stage 4 instantly inspires a tremendous amount of fear. But stage 4 has different meanings to it. Stage 4A means that your tumor is still in the pelvis, but it's maybe grown into the bladder or the rectum. We still consider that largely curable, and we would still recommend brachytherapy for a lot of those women. For stage 4B cancer, we use it more selectively. There are some women with what we call low volume metastatic disease, or women that, even though they have metastatic disease, will live for a long time. We recommend brachytherapy used to maximize control of the tumor in that area. Sometimes when we skip out the brachytherapy portion, we can't deliver safely high doses of radiation. And even though women will live for years, even with the metastatic diagnosis, brachytherapy can really help control the tumor in the pelvis, preventing bleeding and pain and other organ damage.
Wow. Okay. How effective is brachytherapy for cervical cancer?
So brachytherapy can be very effective, but what I want to highlight is brachytherapy in general is not used in isolation. Brachytherapy is generally part of a package. And if you skip portions of that package, you may be shortchanging yourself from maximally curing or maximum possibility of a cure. So when we talk about the efficacy of brachytherapy, we generally talk about the efficacy of brachytherapy when it's combined with the other things that we use along with it, external beam radiation, as well as chemotherapy. When women receive the optimal package of treatments, tumors in the pelvis, the cervix cancer itself, can generally be controlled somewhere between 90 to 95% of the time. That still means that the cervix cancer can recur elsewhere, but 90 to 95% of the time in the cervix, it will be controlled when it's done well, and the entire package of treatments is used. For patients that choose to omit brachytherapy, or for some reason maybe their doctor doesn't offer it to them, even though it's right, we think that risk of recurrence will increase 30 or 40% more than without. So shortcuts can have big consequences. So we recommend patients try to get the maximum efficacious treatment when possible.
Wow. This is fascinating.
Yeah, it's really important to consider this. Patients have lots of options to go to for a place for having cervix cancer treated, but we know that for a number of years, brachytherapy use for the right patient had been declining in the U.S. And consequently, women were having worse outcomes for probably 10 years in the U.S., which is just really tragic to see. Fortunately, the most recent data shows that there's a bit of a renaissance. We've really educated other physicians to make sure that they do not shortcut their patients when it's right for them. And we've seen a bit of a resurgence in the use of brachytherapy for the right patient.
That's amazing. Sorry, my something went wrong with my phone for a minute, so I lost you for a second, but
Okay.
thank you. What can patients expect during brachytherapy for cervical cancer?
Yeah. So Aisha, for that, do you mean more like what kind of, would you like me to kind of share what the patient experience could could be, like an example of a day, or a little bit more broadly? What do you think?
Yeah, I mean, like, so for me, just my
Yeah.
experience, I had no idea what to expect when I mean, you know, the whole, when because I was first diagnosed with stage 2B. And so they gave me a treatment plan. I was just like, I didn't ask many questions. I was like, let's get this done. And I thought brachytherapy was like a clinical trial. The way it was like presented to me, I thought it was optional. I thought it was like maybe just testing things out. And I've talked to other people who kind of thought the same thing. They had no idea that it was just like contraption and kind of what to expect. So maybe just like, or the fact that they were going to be hospital, you know, like sedated. So
Yeah,
maybe just like taking people through like the day, what to expect.
sure. So I, I appreciate you sharing your experience, because what we have an understanding of is clinics work in many different ways, and we really would like patients to be informed to as much as they would like about what their experience would be. Ultimately, it's your body, it's your choice to undergo this treatment that we recommend. We want you to be very informed, ideally very involved in your care as well. Um, Brachytherapy is certainly not a clinical trial, though. It's part of
Yeah.
the standard package, and so it is important to use. So I'll speak a little bit about our workflow at Penn Medicine, but what I want to highlight is that there are many different ways that brachytherapy for cervix cancer can be delivered effectively and safely, even though there are different styles in which clinics. So regarding our clinic, for our patients, they would have 5 weeks of external beam radiation combined with chemo therapy, which is delivered once per week. And then in week 6 of their treatment, in week 7, we do once per week, we do a single procedure under general anesthesia. So we've made a very strong point that we want our patients to be asleep while we do these procedures. These procedures can be extremely uncomfortable, can be painful, and they can lead to bleeding. So we want patients to be asleep for this time. When a patient wakes up from that procedure, the brachytherapy applicator is already placed inside the patient. Then they come down to our department. They have an MRI with the applicator inside. Then for about 1 to 2 hours,
I think we lost sound. Can't hear anything. Oh, I think, are you back?
how about
Okay.
now?
Yep. Gotcha.
So a procedure under general anesthesia, when the patient wakes up, she has the applicator inside of her. She goes down to our department for an MRI scan. And the MRI scan is done with the applicator inside the patient. After the MRI scan is acquired, then we map out the radiation oncologist as well as the radiation medical physicist, where we want radiation to go and where we don't want it to go. That generally takes a process from 1 to 2 hours with multiple quality and safety checks along the way. And then to receive the treatment, the applicator inside the patient is hooked up to a machine called a radiation afterloader, which looks a lot like a very fancy, rolling, very expensive suitcase. Not interesting, but that machine is wheeled over to the bedside of the patient. Hollow tubes from that machine are connected to the hollow tubes from the applicator, and the patient receives the treatment. During receiving the treatment, the machine may make a slight clicking noise, but there's no pain, there's no heat, there's no burning. Mostly our patients will notice the clicking noises, and then we play music in the room as the treatment team comes out. So that's generally the process. But
Mm-hmm.
aspects of the patient experience are patients are laying flat generally on their backs during this time. And that's pretty weird to lay down awake for multiple hours. It's
Yeah.
pretty Women have a Foley catheter placed in the bladder because we can't have you get up and walk around. So urine is draining through that catheter during this time. And generally, um, most patients, again, are laying flat at a slight angle, but most of our patients are also pretty bored. They're waiting around for things to happen as we map out the radiation. So we encourage people to bring a book, a phone, a friend, a loved one, something to keep their mind occupied.
Mm-hmm.
Say that this is an absolute pleasant experience, I think is incorrect. But we really tried to make it the best possible experience. When women wake up from the anesthesia, there's pelvic pain, there's pelvic discomfort, there's a lot of pressure, and then there's the grogginess from it. So we give pain medications as needed. We give you snacks. We really do our best to take care of you during this time. But the experience is different. Some clinics don't use anesthesia at all.
Oh.
Sometimes they might give an Ativan and really just try to get it done. It's not my preferred style of treatment, but it can be done effectively. There are some clinics which will keep women during the entire time. There's a very, very few clinics, but it is possible.
I see. Okay. Amazing answer. Thank you.
So would you find that that's very similar to your experience or very dissimilar? There's lots of different ways in this is done.
More or less. I mean, I went in, I remember the whole mapping process, and when I was I feel like I did kind of spend more time back in the room. And that just could have, I was like foggy. I was definitely under anesthesia, but it could be foggy. But I remember they would ask me what music I wanted to hear. And, it was, so I just remember all the chatter, and I'm like, so I don't know if it was a long time I was in there, but it felt like a little while. And, I remember and then they would take me back. I know that I do remember there was like some sort of waiting period, but I don't recall being, I don't recall, oh, goodness. I recall the waiting period more so just being safe to leave. I don't know if I was waiting for something else to happen. But what I'll never forget is, just because I guess they remove the implant as you're starting to wake up.
Yeah.
So I think that was not my favorite part.
Yeah, which is also very real. Again, different clinics have different workflows, but from the time the applicator is in to that first treatment is generally around 2 to 4 hours.
2 to 4 hours.
It's not a short treatment. In some clinics, maybe 2 to 6 hours.
Yeah.
There's differing levels of anesthesia, so I believe somewhat strongly in having anesthesia to at least put the applicator in.
Yeah.
Some clinics that have anesthesia available to take the applicator out, which is really nice. Many don't, though, because removing the applicator there's a lot of pressure and pulling, and there can be pain for at least a couple seconds. The nice thing is, Naisha, please feel free to if your experience was different. Once the applicator is out, most of our women feel generally very well, or they're feeling a lot better.
Yeah, no, I mean, there wasn't much lingering pain or anything like that. It's just that moment of coming to while the applicator is being removed. But I don't recall being in any sort of pain once I was done and going home.
Right.
Just tired.
It's a long day. It's a very long
day.
We try to give snacks, but it's not enough to make the day shorter.
No, not much. So are you radioactive after the implant? If so, for how long?
Yeah, so the short answer is no. You are never radioactive, not for a single second after the implant. In the old days, when we used to treat patients and place the radioactive sources inside the patient for 1 to 2 days, then there was some radioactivity with loved ones or staff were coming in and out. But for modern radiation treatment in the vast majority of centers, as soon as the treatment is off, which usually only takes 10 to 15 minutes, you are never radioactive. Okay. So once you go home, you're immediately safe to be around children, loved ones, share a bed, be around pregnant women, hug your dog. You can do whatever you'd like.
Okay, cool. So, I mean, you kind of answered this, but what is the recovery time for brachytherapy?
Yeah. So brachytherapy generally happens at the end of external beam, which is external beam treatment after those 5 weeks, which is a generally pretty intense period. There's tiredness, there's loose bowel movements, there's a lot of emotions going through all this. So recovering from brachy is still recovering from the external beam treatment. Yeah. To say that I've had patients that will go into work in between procedures, which is impressive and unnecessary unless they had to go into work or they really wanted to. So I've had patients go in the next day to work. I really recommend everyone just take the time off.
Mm-hmm.
Most patients will need a few days after the last procedure for a combination of things. Being in bed for a long period of time is very unnatural. So sometimes people are finding their feet again. Um, and processing the experience is also takes a couple days. So most patients will need at least a few days, but every woman is a bit different.
Gotcha. Okay. What are the short-term side effects of brachytherapy?
Most patients will not have any short-term side effects of the brachytherapy portion. They're likely still feeling those side effects of the external beam radiation. But that's not to say that brachytherapy causes nothing. Most of the discomforts around the brachytherapy portion are related to the discomforts of the applicator placement and removal. So those can be uncomfortable. Um, but just the brachytherapy itself, generally not. And there are risks of the procedure. There's risks of bleeding. There's risks of infection. There's risks of pain. So the brachy has risks, but generally it doesn't really increase loose bowel movements. It doesn't really increase fatigue for most patients.
Okay. Okay. Um, are there any long-term side effects of brachytherapy?
Yes, brachytherapy can have side effects that are um, generally part of the package of the entire curative treatment package. Um, so brachy by itself, if done safely and done in a high quality fashion, generally in a center with high volume experience, as well as access to an MRI and ideally anesthesia, the risk of serious long term side effects of this total package of treatment is generally on the order of less than 3%, and maybe up to 5%. But most patients for the package will do quite well with modern treatment. Again, there is a tremendous amount of training and attention to make sure that a clinic can deliver the highest quality treatment. So these long-term side effects might be arranged depending on where you go. Um, with the brachy itself, if a patient was to skip the brachy, they would have less of those long-term, potentially dangerous side effects, but the likelihood that their cancer comes back becomes substantially higher.
I see. Okay. Um, okay, what can be done to prevent or relieve long-term side effects?
So preventing the long-term side effects is very difficult, in my opinion, on the patient level.
Yeah.
Aside from the things that one should be doing to make their mother proud of them, eat a healthy diet, stay hydrated, plenty of mental and physical exercise. The bulk of the burden, in my opinion, is on the treating physician and the treating clinic
Mm.
to deliver their best possible care.
Yeah.
When the external beam radiation and the brachytherapy is done in a very high quality fashion, that's probably, again, in my opinion, the biggest determinant to if a patient will have the lowest long-term side effects. So our expectations of patients are, I need you to show up. I need you to tell me how you feel because I can help you out.
Yeah.
Um, I need you to take care of yourself. The remainder of it is the responsibility of the physician in the clinic.
Mm-hmm. Mm-hmm. Are there any alternative treatment options to brachytherapy?
Yeah, this is an interesting question, and I'm going to give you a little bit of a yes and no. Um, when we talk about this, generally it's considered a package. And if a clinic is to say, I don't think I can offer you brachytherapy or you're not appropriate for it, there has to be a very, very, very good reason. And that may be inability to receive anesthesia. It may be because the patient, despite knowing that this is probably the best um, for their care, will choose not to do this. There's multiple reasons why a patient would not want to undergo this. We have women that can't receive anesthesia. We have women that are the victim of sexual abuse and trauma that don't want anything placed inside the uterus or cervix and vagina. I don't blame them for that. So there's reasons to avoid it potentially. But the alternative options in general have never beat brachytherapy in terms of both efficacy and safety. For certain patients who decline brachytherapy or really are not candidates, and they go to a second center who also agrees, we can sometimes offer additional external beam radiation treatments. General, that's not considered as effective, but it may buy some more time. Techniques like IMRT or SBRT could be used. Some patients may go to a surgery, even though for locally advanced cervix cancer, generally surgery does not have a role for their care. So there are alternative options. The challenge is those alternative options are either less efficacious or potentially less safe.
Okay. Okay. We have a couple more questions. Is that okay?
Absolutely. Absolutely.
Okay. So one came in live. So please address high dose brachytherapy as part of a package along with chemo for stage 1A, grade 3 endometrial carcinoma. Is this common? How successful is it?
Yeah. Thank you to Kotech Elizabeth for the question. So to clarify, the viewer asked adjuvant treatment for stage 1A grade 3 endometrial carcinosarcoma. Is this how successful is it? So we are focusing tonight on cervix cancer, but you bring up endometrial cancer, which is a type of a uterine cancer. Carcinosarcoma is a uncommon type of uterine cancer that affects probably single-digit percentages of women with uterine cancer, which currently affects around 55 to 65,000 women a year in the U.S. and is weirdly increasing due to increasing obesity in the U.S. This package of treatments is chemotherapy combined with vaginal brachytherapy, a type of high-dose brachytherapy. It is generally extremely effective in terms of controlling the tumor in the vagina. However, a percentage of patients will have still a distant recurrence, and that is generally best addressed by chemotherapy, which works for most patients, but it does not work for all.
Thank you. So I guess last question. Is there anything else you think that patients should be aware of about brachytherapy?
So brachy is important in patients who are receiving this kind of treatment, particularly women with locally advanced cervix cancer. I would really emphasize patients should talk to their physicians about the role of brachy if they have locally advanced cervix cancer. And they should have a real clear reason if they're not being offered it. Shortchanging patients for this type of treatment can really affect their cancer outcomes. So first, I want women to be aware of it. The second is I want women to ideally be less afraid of it than what it is. It's a very weird thing to say that we're going to deliver radiation from the inside out. It's a weird thing.
Yeah.
It's true that it's weird, but we do our best to explain it, but it never really makes sense until a patient experiences it.
Mm-hmm.
Another thing about brachytherapy is that there are definitely discomforts associated with it. It is unavoidable that there is some degree of discomfort associated with it. It is an invasive procedure, but I would hope that everyone appreciates that their treating physician is really doing their best to make sure that women are the most comfortable during their procedures. There are different styles in which brachytherapy is done, and different clinics have different workflows, and there are many successful ways to do it. The final thing about that is it's okay to share notes about brachytherapy. Aisha and I were talking a lot about other cervix cancer support groups, and I appreciate that women are speaking about this. Mm-hmm. I think it pushes clinics to do better. I think it informs patients that they know that they have options. I think it informs patients that they can go to higher volume clinics that maybe do this more often. that could be potentially even safer. So those are the things I'd like to stress about brachy.
Thank you. Thank you. Oh, I guess one last question. Can you repeat brachytherapy in your lifetime, or is it just, or can it just be taken once? Sorry.
So it's a great question. For the stepping back and taking a longer view, the goal is you do it once, we do it right, and we never want to do it again.
Right.
So if you do it right the first time, we should never have this question again. But it can be done. However, we recommend it only be done in specific cases for patients that have maybe a recurrence in a specific type of fashion, and they really should only go to a center that has expertise doing repeat brachytherapy. It's not to be done lightly. So it can be done, but really only in certain circumstances. Ideally, again, we do it once and we never have to do it again.
Awesome. Awesome. Well, thank you all for your questions, and thank you for joining us, Dr. Tonk, and everyone who participated. Please be sure to check out our upcoming educational programs and support groups. They are pinned in the chat. Also follow us on social media. Dr. Tonk's Twitter or X is linked in the questions. This concludes our Instagram Live. Thank you all.
Great. Thank you all.
Thank you. Bye-bye.